Hello students, I'm Dr. Gonzalez, and on this video we're going to talk about the spinal cord and the nerves. And so if you want to take a look at the objectives, just stop the video for now and check out this part of the presentation. And so let's just go ahead and get started immediately with the cells. So as part of your nervous system, we have two major cells, which is the neurons and the neuroglia, also known as supporting cells. Neurons are the ones that are responsible for reception, integration, and nerve impulses, aka action potentials. And the supporting cells, also known as neuroglia, these are cells that are protecting or supporting neurons in different capacities. So within the central nervous system, we are going to find these astrocytes, oligodendrocytes, microglia, and ependymal cells. Meanwhile, on the peripheral nervous system, we're going to find Schwann cells and satellite cells. But just a quick FYI, both Schwann cells and oligodendrocytes, these cells are going to be technically analog cells, so they're doing basically the same thing. They are creating what we call the myelin sheath to protect the axons and allow the faster conduction of these action potentials. Only difference is that one of them it's located within the central nervous system and the other it's located in the peripheral nervous system. So some of the important parts of a neuron include the cell body, dendrites, and axons. Right within the cell body, also known as the soma, which is another way to call it, is the central part of the neuron where we have nucleus and other organelles that are part of your cells. And so the dendrites and axons are specialized structures of your neurons. For example, dendrites are going to carry impulses towards the cell body. Meanwhile, the axons are going to carry impulses away from the cell body for communication with another neuron or, for example, with a structure of the body. So very important here, this is a picture showing you how an axon and a dendrite looks like within a neuron. And you can see that the dendrites, there's going to be a lot of them. This is typically known as a multipolar neuron, where there's going to be multiple dendrites to receive that communication from another cell, and then the axon to send that information or conduct that nerve impulse towards the other cell, right? So in the nervous system, remember, we have two classifications. We have what we call the central nervous system, or CNS, which it's specifically the brain and the spinal cord and nothing else. And then we have the peripheral nervous system, or also known as PNS, which includes other additional structures outside of the brain and spinal cord, which include, for example, your spinal nerves, cranial nerves, ganglions, etc. Right? And so at the same time, we can subdivide, right? So if we have your peripheral nervous system, right, you can subdivide it also into a somatic nervous system and an autonomic nervous system, or ANS, right? And so the somatic nervous system, don't forget that this is what control your skeletal muscles, right? And then your ANS, it's what we our body use to control your smooth muscle, cardiac muscle, glands, etc. Right? Glands, smooth muscle, cardiac muscle, etc. And so this ANS, it's also going to be subdivided into what we call as the parasympathetic and the sympathetic, right? And so parasympathetic, don't forget that this is what we also call the rest and digest, right? Whenever you are resting, we are using our parasympathetic system. And your sympathetic, it's also what we call your fight or flight, right? So fight or flight, it's part of your sympathetic, right? So here is just an overview of where you would find, right, the brain inside the cranial cavity, the spinal cord inside the vertebral cavity or spinal cavity, and then those spinal nerves, right, that are part of your peripheral nervous system, right? So let's talk about now the spinal nerves, right? Spinal nerves, as the name implies, are nerves that are coming from your spinal cord. And so there's going to be 31 pairs of spinal nerves. And so these spinal nerves are going to be located or coming through the same area that are going to be your vertebrae. So for example, we are going to have cervical spinal nerves, thoracic, lumbar, sacral, and coccygeal. Only thing is that there's going to be some differences. For example, if you recall, we have a total of 7 cervical vertebrae, right? But in this case, if you notice over here, we are going to have 8 spinal cervical nerves, right? So that's a difference there. We have 12 thoracic spinal nerves, 5 lumbar, 5 sacral, and also, if you recall, we have 4 fused coccygeal vertebrae, right? But we only have 1 coccygeal, not cervical, but coccygeal spinal nerve, right? Or 1 pair. So there's going to be also from T1 down, the spinal nerves are named according to the vertebrae locating above the nerve as the nerve exits the vertebral canal. So for example, T6, right, it's the spinal nerve that exits the vertebral canal between T6 and T7. So that is an important thing to mention. Another thing that we gotta go over, if you look over here, it's that your spinal cord, right, if you notice, is gonna have these enlargements, right? There is a cervical enlargement and there is a lumbosacral enlargement. There's also going to be other structures that are super important. For example, this conus medullaris, which is the end here of the spinal cord. There's going to be a cauda equina, which we're going to talk about. And then there's going to be a filum terminale, which attaches your spinal cord to the coccyx over here. So that is another very important structure. So if you look over here, there are certain important characteristics about these spinal nerves. So these spinal nerves are formed by the union of 2 roots. For example, in the L4 spinal nerve, right, this exits the vertebral canal between L4 and L5 vertebrae. And like I said, these are formed by the union of 2 roots. We are going to have, for example, a ventral root, which also it's known as the anterior root. And we're also going to have a dorsal or posterior root, right? Typically, the ventral roots are nerve fibers that carry impulses away from the CNS. And then the dorsal root or posterior roots, they are going to be nerve fibers that carry impulses towards the central nervous system. So that's a major distinction there. So in other words, your ventral roots are going to be carrying impulses that are what we call efferent fibers or motor fibers. And then the dorsal root are those that are carrying impulses towards the central nervous system. So these are going to be sensory or afferent fibers. So that is also a very important thing to know. So remember that in general, we also say that your spinal nerves are mixed nerves, right? Because they will contain both sensory and motor fibers. So what is exactly what we're talking about. So here I have a picture, and I also have the model right here, very similar to this picture. So if you notice over here, what I was just saying is that these are your ventral roots right here, and these are going to be the dorsal roots. And when they come together, these roots all together, they are forming a spinal nerve. And this nerve, it's what I was saying, that it's actually composed of both motor fibers and sensory fibers. So you're going to have both in there. Another thing you got to notice over here is that your dorsal roots are going to come together, and there's going to be an additional structure that we call the dorsal root ganglion, right? And this dorsal root ganglion, it's an area. Typically, ganglions are structures that contain the bodies of neurons. So just to give you a quick overview of what we're looking at, right? So remember, if you have a neuron, which we were mentioning before, right? Let's say that this is the cell body or soma, this is the axon, right? And these are the dendrites of a neuron, right? You're gonna see that typically the cell bodies are always found within your central nervous system, for example, specifically in an area that we call the gray matter, right? The gray matter is where we typically find the somas. And then the axons are typically located in an area that we call the white matter. Now, in the peripheral system, the cell bodies are also located in these ganglions, right? These ganglions, like this dorsal root ganglion that you're seeing right here. And the axons are located within the nerves, right? So this is how you have to study when you're looking at these neurons and these actual macro structures, right? Because you have to think, okay, where is the neuron, particularly the soma, where's the axon, right? So that's what we're looking at here. Hopefully that makes sense. So your spinal nerves are, like I said, made up of these axons. So you're going to have motor and sensory axons in there. And so they can be divided into 3 branches typically. We're going to have a dorsal or posterior ramus or ramus. We're going to have a ventral or anterior ramus and a recurrent meningeal branch. What is this particularly? So the dorsal ramus or ramus, it's the part that supplies the skin of the back and the deep back muscles, right? Then you're going to have the ventral or anterior ramus, which is going to supply the skin and muscles of the limbs or extremities, right? The skin and muscles of the anterolateral trunk, the skin and muscles of the anterolateral neck, and superficial and intermediate back muscles. So as the name implies, they're going to be directed to that area. And then the recurrent meningeal branch is going to supply, as the name implies, the meninges, blood vessels, ligaments, and the periosteum and intervertebral discs. So that's what you're going to see in there. If you look at this picture particularly, we're looking at a transverse section of vertebrae, right? And the spinal cord right here in the center. So this is the body of the vertebrae. So that means that that's the anterior part, and this is posterior. So you're going to see the spinal cord over here. And you're going to see that the spinal cord, it's going to be protected by these meninges, which I'm going to mention in a second. And you're also going to see that the spinal cord has this structure that looks like a butterfly, right? So this butterfly, this is what we call the gray matter, right? What I was mentioning earlier, remember, going back to the gray matter. So that is where we're going to find typically a lot of these somas with these dendrites, right? Within this gray matter. And then if you notice, around the gray matter, we have this white matter, right, which I was mentioning earlier. That is where we typically are going to find these axons that I was mentioning before, right? So And then it makes sense that if you have a neuron over here, right, the specific cell body, right, it makes sense that the axon is passing through the white matter and then it's going to go through these roots, right, depending if it's coming in or going out, right? It's if it's afferent or efferent, right? And then that's going to be merged within a nerve, right? Hopefully that makes more sense. So there's three branches, like I was saying before, of mixed nerves. These ventral rami of the thoracic spinal nerves, except for T1, will have a segmental distribution, and they do not share fibers with the nerves above or below. And these are going to be typically from the second, right, so T2 to T11 intercostal nerves and subcostal nerves. And then T1, it's going to be lumbar and sacral spinal nerves that share. T1 together with lumbar and sacral spinal nerves are going to share fibers with nerves located either above or below to form plexuses. So plexuses are going to be a bunch of nerves coming together to innervate now a specific region of the body. So we can divide them into four major plexuses. So we have cervical plexus, brachial, lumbar, and sacral. If you notice, cervical plexus is going to innervate the area of the neck, right, with some exceptions. For example, the phrenic nerve. So cervical plexus comes from the ventral rami of C1 to C4. Then we have brachial plexus, as the name implies, is going to be supplying this area of your upper extremity. So, and this comes from the ventral rami of C5 to T1. Then we have lumbar. Lumbar is coming from ventral rami of L1 to L4 and is supplying the abdominal wall and the lower limbs. And sacral plexus, which is also on the lower limb and the perineum. Only difference is that lumbar plexus, it's innervating the anterior aspect of your lower limb, and then the sacral plexus is innervating the posterior aspect of the lower limb. So make sure that you know that difference, right? So most nerves are going to originate from plexuses that contain fibers from ventral rami and more than one spinal nerve. So quickly, let's go over some of these plexuses. You're going to learn more about these plexuses as you go through Gross Anatomy 1 and Gross Anatomy 2. These we're going to see in Gross 1. So cervical plexus includes nerves such as the lesser occipital nerve, the greater auricular nerve, and the ansa cervicalis. We're going to see that when we get into the neck. Brachial plexus, you're going to see it when you get into Gross 2, which includes some nerves like the median nerve and the ulnar nerve, right? This is going to be a very interesting dissection when you get there. Here are some examples if you want to stop the video and take a look at it. Lumbar plexus is also part of Gross 2, where you're going to have some nerves such as the femoral branch and genital branches. And sacral plexus, which is very similar to this model that I have right here, that sacral plexus. It's going to be innervating that posterior side of your lower extremity, and so you're going to have nerves such as the gigantic sciatic nerve, right? So this is an example of how that looks like. Another very important thing we have to discuss is the dermatomes, right? So dermatomes are, it's in an area of the skin that it's going to be innervated by sensory fibers of a single spinal nerve. And so, based on where those spinal nerves are passing by to innervate that cutaneous area, that's why it's called derma. Derma means skin, right? It's going to be innervating that region of the skin. So if you look over here on this picture, it's kind of like color-coded. You can see that green is going to be innervating the sensation of this part right here on the cervical area and parts of the upper extremity, right? So C2, C3, C4. Then if you look over here at the chest, you got the thoracic region. Like for example, this is one way to always remember it, right? There's certain landmarks that we use to remember it. For example, the nipples are going to be T4, Meanwhile, the umbilical region, the umbilicus, is going to be T10. And if you notice anteriorly, these are going to be lumbar, right? Posteriorly, you have very similar structures being innervated by these nerves. And then, except for the lower extremity posteriorly, which these are sacral. Now, let's take a look at the actual spinal cord. The spinal cord is located within the vertebral canal. It begins superiorly at the foramen magnum, and it ends inferiorly between the levels of L2 or L1 or L2, right, in an adult. It has a couple of enlargements, as I've mentioned before. Cervical enlargement, it's between C5 and T1 because that's where we get the brachial plexus, right? That gives rise to the brachial plexus. So that's why it's so important. And then we got the lumbosacral enlargement, or particularly in this case, we're looking at the lumbar enlargement. And so this comes between L1 and S3. And so this is going to give rise to the lumbar and sacral plexuses, right? Then the spinal cord will taper off into the conus medullaris. And there's going to be a structure called the filum terminale, which attaches the spinal cord to the coccyx, right? And so there's a few important spinal cord development things that we need to discuss, including how the vertebral column grows faster than the spinal cord during the embryonic stages. So at first, during embryonic stages, the spinal cord will have the same length as the vertebral canal and matching the vertebrae. But then as we are growing inside our mother's womb, then the spinal cord, the vertebral column grows faster and the spinal cord remains or looks shorter in that way. So that's why if you look over here at 6 months of pregnancy, the spinal cord is going to be ending at the level of S1. And then as a newborn, the spinal cord is ending at the level of L3. And then as we grow into adulthood, it's going to be between L1 and L2. And so here, if you want to take a look at these pictures, it's just showing you the development of the spinal cord and explaining in a picture what I just mentioned, right? So another very important thing that we're going to see is that because of these difference in length, now the spinal cord, it has to have or creates these projections, right, that we call the cauda equina. These nerve roots are inferior to the conus medullaris. So if this is your spinal cord where you got the conus medullaris right here, it's gonna look like this, right? So those are what we call the cauda equina, and so these are gonna be hanging like a horse tail from a lower part of the spinal cord. So because of the difference in length between the spinal cord and the vertebral column, the spinal cord segments do not correspond with the vertebral levels, right? Another thing that's very, very important is the meninges. So there's going to be 3 meninges that are protecting, it's connective tissue that is protecting your spinal cord, also in the brain, right? But in this case, we're talking about the spinal cord. And so that's going to be the dura mater, arachnoid mater, and pia mater, right? The dura mater is the outermost layer. It's a very dense, strong, fibrous sheet that is protecting your spinal cord and also the cauda equina, and it's continuous with the dura mater of the brain, and inferiorly it continues to the dural sac, and it terminates blindly at the lower border of S2. So here's the dura mater. You can see it's the outermost layer. Here's how it looks like in the brain. The dura mater has actually 2 layers, a periosteal layer and a meningeal layer. And so the dura mater, one of the important things about this is that it is separated from the walls of the vertebral canal by the epidural space, right? So besides protecting your spinal cord, is creating certain spaces. So this epidural space, you might have heard it before, because this is the space where typically doctors or nurse practitioners are going to be injecting anesthetic agent for females that are about to give birth, right? Or some type of other epidural anesthesial block. Right. Another thing is the second layer, which is the arachnoid matter. You can see it on this picture over here. This arachnoid matter, as the name implies, it looks like a spider web, which is why it's called arachnoid. And it's a very delicate, thin layer of tissue that it's on the internal surface of the dura mater. And so now with these two layers, we can form some spaces, including one that we call subdural space, subarachnoid, and the subarachnoid space. So the subdural space is a space between the dura mater and the arachnoid mater. So it would be located around here, right, between the dura mater and the arachnoid mater. And then the subarachnoid space is a real space between the arachnoid and the pia mater. So it'll be around here, because that is representing the pia mater. And so also, another very important thing is that the subarachnoid space inferior to the conus medullaris is known as the lumbar cistern. And so this is important because if you have ever heard of a lumbar puncture or a spinal tap, which is this picture that you're seeing right here, this is an example of a spinal tap. So spinal taps are designed to obtain a sample of the cerebrospinal fluid, or CSF. And so this is typically administered in this area between L3, L4, or L4, L5 interspaces. Lastly, we got the pia mater. Pia mater, it's the innermost layer, and one of the things that is important about this is the denticulate ligament, right? This is an extension of the pia mater in a coronal plane that helps to stabilize the spinal cord with the dural sac, and it is the only area where we can visually see the pia mater. The rest of the structures, right, in the spinal cord or your brain, it's difficult to see it with the naked eye. Okay. And that is going to be it for today. Thank you for watching, and I'll see you on the next video.